YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Okay, let's try that.
Got it working.
Welcome to the show. Yeah, it's not going the way it normally would, but we got a show. So we were able to talk to people, and you included. When I say people, I mean whoever comes in on the chat, because the chat is working. Well, let's show them the chat. We have Rusty B testing back as we test the chat out.
Uh-oh.
Well, look at that. It was working a moment ago. There we go. We'll try it that way.
None of those are working. Well, shucks.
Pretty cool, huh?
Technology. It's great when it works.
Yeah, how about that? Okay, so Gwen, what's our topic?
I think it's the ACA, right?
ACA, aka Obamacare.
Boy,
So,
that's going
some
way
of you may
back.
know it by that name. Affordable Care Act was put into place in 2010 about. It was during the Obama administration, actually. A little controversial when it came out, 906 pages, if you want to read the whole thing, and you can. It's pretty easy to find online. And it has a lot to it. And we now have Donald Trump is the president-elect, and did take some shots at the ACA last time during his presidency. Although it held, and it did through this our current administration. I think I've heard some things about it being kind of on the chopping block again. Have you heard this also in the news?
Well, I know that,
there's elements of it, or I don't know if there's elements of it. I think they want to just knock it out.
That's part of that
repeal
Project
and replace.
2025, which I'm sure most people have heard of by now, that by the Heritage Foundation. But Project 2025, they want essentially a wholesale rollback of it. Yeah, it's got a lot of stuff in it. But there are a lot of things that we rely on and that we probably take for granted that are in the ACA,
yeah.
and a lot of them are good things. I know when the ACA, Obamacare, was first rolled out, there was a lot of controversy on what it would mean, and these death panels and things like that, and that didn't happen. I remember that.
Remember that? Yeah,
but a lot of the things that came out have been good, and we can list some of those. But that if you're able
major ones.
if you're able to go to your doctor and have your annual without a copay. That's one of those. That is just one of the many. And all of the preventive tests that we do that are recommended by the USPSTF are covered as well. So there should be no out-of-pocket cost for that. So that's one of them. That's probably one of the biggest ones. But one of the other ones is just coverage. Who's able to be covered? It used to. This is going back. Gosh, 2008 is how many years ago now? Is that 16 years ago? Wow. 16 years ago, before 2010, so 14 years ago, before that, insurances could deny you based on certain chronic conditions. So if you were healthy, great, they'd love you, they'd take you. But as soon as you got that diabetes, you could be not covered anymore. You could be covered and it would just be astronomically expensive.
They could actually deny you coverage.
Yeah.
And you wouldn't have health insurance. You go to this other company and try to apply. There were no rules that they had to take you at a certain rate. They could say, okay, we'll take you, but it'll cost you $3,000 a month. And that's what you would have to pay to get. This was really
Sounds
happening.
like my fire insurance.
Yeah. Oh. Interesting. I never thought of
We
the
need an
similarity.
ACA for fire insurance.
Wow.
Anyways,
That is very interesting.
these people are getting dropped left and
there
right.
are some similarities going on there. So people in California, and probably other states too, they're experiencing this fire insurance difficulty.
Or in Florida, probably flood insurance. Pretty similar picture.
I wouldn't doubt it. So that's kind of the situation where prices going up, and they decide, okay, people are especially high risk. We can't deal with them, so we're going to charge them super high premiums, or just simply not even offer a plan to them. That was going on with health insurance prior to 2012. People were running around without health insurance. Usually people don't run. They were, without health insurance, they would be paying exorbitant prices monthly for premiums.
Yeah.
And then along came the ACA, and now we have, yes, prices did continue to go up, not at the same angle, not at the same rate on the graph as what they were leading up to it. And I remember back then, everybody was complaining about the rising costs. Everybody was complaining about either difficulty getting coverage or not being able to get coverage. It was a big deal. For those of you who are younger, it was the thing back then.
Right.
Kind of like the immigration talk now. That was healthcare back in the prior to 2008. Everybody was pulling their hair out. It was the big deal. And then this came along, changed it. Had a threat, 6 years ago we're going to repeal and replace Obamacare. Although there's never really, to my knowledge, there was never much as far as a plan to replace it with ever.
Right, I have not.
That's my understanding. Looking back, I still don't see something that was intended to be the replacement for it.
Right.
Thankfully, it didn't. It went through the courts. It didn't get knocked out. So we're able to keep coverage for people. If it were to be changed in some way in this next administration, we absolutely, it's crucial that we have a very sound replacement in place for accounting for people not being able to keep their insurance plans.
Yeah.
And to not be charged more when they get diabetes, not be charged more when they get COPD.
Whatever that chronic condition is.
These things that, once they happen, you're stuck with that label, and now your insurance is. And I can remember, I was practicing medicine before, I don't know that you were much.
I came out in 2008, so.
Before the Affordable Care Act, I was practicing medicine, and I can remember patients asking me to lie, to not diagnose them with hypertension, things like that. A chronic illness.
They know one on their chart,
I
remember
the diagnosis, which goes along with the treatment, and I would say elevated blood pressure, which is what we should do the first time around.
Yep.
We don't establish hypertension with just a single blood pressure reading, but then they wouldn't come back.
Yeah.
Or rechecks. They're just kind of hoping, which leads to non-treatment.
Right. And then people don't get treated. They get the consequences of that, which is heart attack, heart failure, stroke, and they end up in the ER, which it leads to higher costs. So in the long run,
that's nothing compared to what they live with the effects of the stroke for the rest of their life.
Yes.
So I have not dealt with that. In fact, I hadn't even really thought about it until this week.
Right.
That world of you can't keep it's potentially hurting a patient to put all the information on the record, which is what we do because we're kind of OCD that way of following rules. Never was an issue over the last 14 years.
Right.
And it won't be. We'll practice the same way we are now.
I am going to, document appropriately.
It will lead to patients being very displeased with us
if
something like that were to happen.
A repeal of that,
So that's one. Let's get to your comments and questions. I'd love to put them on screen. Is
it working?
If I could, but if I don't want to take away from the show to try to find just the right little thing here. I'll do one more look for it here. because I like it when I can put your comments and questions right on the screen, and we do have a couple of them waiting to be put on there. We'll try this one and see if... Oh, look at that! It came right up. Woohoo! Yay!
Worked.
So, Rusty, I tested the chat before the show started, so that's what it is.
It was working before.
And then Hilda says, it's all high, out of pocket.
Yes.
Hilda, I don't know how old you are, but 14 years ago, even though it's high now, things were worse.
Yeah.
Maybe not as high as they are, but prior to the inflation and the way things were going, it was madness back then. And then Anna Silva, my daughter came to live with me, 55 years old and never worked. She needs an affordable plan that I will pay for her. I'm retiring, taking less than $1,800 a month. I need help with that.
Wow.
Wow.
At 55 years old,
wow.
you're not ready for, you can't do Medicare. So you need to buy off the exchange.
It'll be off the exchange, which exists.
That's another thing from the Affordable
Since
Care
2014.
Yes.
So we talked about the dropping of coverage. Preventive care. This is another thing.
Huge.
So it says that things that get a grade A or B in the United States Preventive Services Task Force, so that would be like mammograms, for example. That gets a grade of B, getting a mammogram every other year between the ages of
40 and 75.
Okay. So insurances cannot charge a deductible, cannot charge a copay for that preventive service. And there's other things like colon cancer screening, for example.
Right.
There's some other things. I believe preventive services like vaccinations, your flu shot.
Yes. Yeah. No copay for
So
that.
these are those things that we absolutely want people to get, to not have any impediment to get it. There have been studies done to prove that when people have any barrier of some kind of a cost between them and getting preventive services,
it will not get done.
there's a reduction in the amount of preventive services that get done for people, which then leads to
all those things we talked about.
Not catching the cancer
Finding
when you
things
can
later,
get rid of it with a
have more costs, more
colonoscopy.
debility, more death. More,
Yeah. So not getting things discovered, not getting them treated.
Yeah.
It gets more expensive actually. So it's
You're actually
it is
a net
well worth
there.
it to keep that in place. So that's another part of it that I very much, and I'm just picking out the two big ones that come to mind right off the bat that I really, really, really don't want to lose.
Right.
Covering for preventive services, and if you come to think of it, I guess we actually do benefit from one of those. We benefit from the shots, but we don't benefit from the colonoscopies, the mammograms. That's not our pockets at all.
No.
We want this because of what it means for patient health. That's why we want it.
Yep.
So let's open it up. We'll go ahead and get out here. Hilda Bauer is letting us know her age. Thank you, Hilda.
Yeah.
Oh yeah,
So she would remember.
She was the one I was talking to about what things were like in 2000.
Probably don't want to do that next one, but appreciate the comment. We'll keep
Lindsay,
this.
we appreciate the sentiment. It's not going on the screen, but
Yes.
how did it slip through? We're supposed to have filters for that.
Wow.
I guess I
Man.
didn't turn it on. Maybe it's another one of those things with the hiccups here. But yes, thank you, Lindsay. Oh, let's take a little break in the show here now for Lindsay specifically. Lindsay, who is one of our, she is our main person on Patreon at VaughnMD.com, or Dr. Vaughn, DOCTORVO at Patreon. There'll be a link on it. You can find links on it all over our description. But I wanted to tell Lindsay about the Denim Nuns because they had an album come out late last week, and it's her thing. She'll listen to it.
Sweet.
I like it. I don't know.
Denim Nuns.
Last track is 10 minutes, but it's well done. And these kids are really like
Kids.
recent graduates. One of them graduated from Placer. Her dad was a classmate.
Nice.
But yeah,
The
Denim
Denim.
Nuns. They play locally. They play Fig
Cool.
Tree and local events. Okay, back to the show. Waiting for another comment so that Lindsay's is not the one that I accidentally.
Accidentally click. Oh man, yeah, that would.
I think she's referring to more than just our concern about the Affordable Care Act.
Probably.
But that's what we're focused on here.
Part of the Affordable Care Act was the requirement that everybody had to have insurance.
That is true, the mandate.
It was a mandate.
That
you
went
had to
through
have
the
insurance,
courts, too.
and that went through to courts, has continued, and has been held up. And that kind of goes back to this idea that of healthcare as a right, which we don't need to get into. But part of this Project 2025 doesn't feel that way. Doesn't feel that getting healthcare is a right that you should hold. So that means that they don't want to have that requirement that you need to have health care. And unfortunately, if that were repealed, those among us who are not as fortunate or not as well off, if you're going to cut something line item by line item on your budget, healthcare may be one of those to go if you're choosing between that and paying rent.
Well, yeah, if it's a premium and you're not immediately having something
and you're not going to
done.
feel. And then, so what does that mean? That means you don't have a primary doctor. That means your care is through the ER. That means actually those costs go up and then are passed on to everyone else as a result. So, and we're talking, the lower income people. People of color mostly affected by that, as was the case previously, before we had the mandate that everyone needed health care. So, you paid us back.
Did you see that?
I didn't see that. Tip for the spare jar. I love it. That's great. Oh, man.
Thank you, Lindsay. We very much appreciate it.
Oh, yeah.
Thank you. Okay.
Yeah. Let's see, what else? What else about the Affordable Care Act? Those are the big ones that affect us and that we see
I
kind
don't
of
know
readily.
was I mumbling it loud enough, clearly enough when I was going through the different parts of it?
Some parts
you
of
were
it.
in the office and I was kind of reading through
Parts of it.
like the contents of this 906-page document, just the different things that it brought out. Yeah, there was I just wanted to focus on the two, but
there are many aspects that it affected.
It did cover a lot of stuff. Yeah, and we don't right now take Medi-Cal, our state's Medicaid program, and so a lot of the way that it would steer patients into plans for that covered California. That's what it's called. It's not as much a factor of our day-to-day practice here, although it is a very big deal in the state at large.
Absolutely.
I'm trying to remember what the statistic was. Is it 1 out of every 2 children born in the state is covered?
Is Medi-Cal? Wow.
It may even be higher than that. I'm trying to remember what it was. It's big part of the coverage of pediatrics, absolutely, in California, and probably other states too, I would guess.
Sure.
So younger families, this is even a bigger deal to them than it is to people who don't have.
Yeah, I think that was part
children.
of the ACA to give more money to states to expand Medicaid, if I remember.
I think so.
That was around the time where Medi-Cal, I think this was part of it, that turned into managed care, where they were kind of almost like a Medicare Advantage plan. They were kind of contracting it out. And I just remember there was a lot of confusion on how that worked originally.
Yes, as there is
what a
with
Medi-Cal card was. Anytime anything's rolled out.
Any insurance coverage, whether it's public or private, the only one that's not confusing is fee for service cash, which doesn't exist.
Show up.
Okay, it exists somewhere. Those concierge guys are out there, but we try to provide what we consider to be pretty close to concierge level service. For people with insurance. We're trying to reach that balance there, so we'll keep that going. Yeah. That reaches the end of the material that I had for the show. It reaches the end of the comments. Not as long as the last couple of shows we had, but I feel like it's good information I wanted people to be aware of, have the background for it, as we may see this becoming
be on the lookout.
The conversation
for the changes
with
that are coming.
The change of administration. And if you are one of those people who does have conversation with the elected representatives, please have in front of mind these, at least these two, if nothing else, of the Affordable Care Act need to be preserved. If not the whole thing. We can modify policy from where it is, probably easier than a repeal and replace type of wholesale change. Please don't put us through another wholesale change in how healthcare occurs in this country. Please.
That would be huge.
We did it a few years ago, and we kind of have a semblance of. I actually feel like we have a system that we can work from.
Yeah.
Rather than to have to wholesale replace the whole thing.
Right.
There's arguments for both sides.
Right. Yeah. We know spending is a lot.
There's been a lot of fine tuning and changes being made.
But it's not these things. This is not what's causing all the spending problems. It's not. Yeah. It's not the getting the health maintenance stuff. Preventive screening.
Please don't take that away. Okay.
Yeah.
So, anything you want to put out there until next time?
No.
I will again give a little promotion for the Denim Nuns. I actually saw them.
Denim Nuns.
I don't think I've ever seen them live. I don't think, but I have seen them online. But they're local, and they put out the new album. I know Lindsay will be into it. I'm confident of that. So, until next time.
Hey, I'm Dr. Wayne Baugh.
Dr. Mark Vaughn telling all of you to stay in good health. Yes,
it's a button.
He's looking for.
But that's not working today.
There we go. We'll give you this.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.